Every high-achieving career eventually hits a specific threshold. You hit targets, build wealth, and secure titles, until that upward trajectory locks into place. Success concentrates resources and accolades onto an individual. Significance reverses that flow, directing that same accumulated power outward to serve a collective need. Leaving a mark that outlasts your own lifetime requires stepping outside your specific industry. It means finding a structural fracture in society and applying your influence to repair it. A leader's acquired influence represents a massive reserve of potential energy. It finds its highest utility when applied to a cultural crisis that is actually worthy of that weight. Take the National Health Service. It is an engine of scientific rigor and clinical exactness. Yet underneath the monitors, there is a severe cultural vacuum. This gap creates highly specific, very quiet suffering. In wards across the country, some Hindu patients are going hungry for days simply because authentic Sattvic vegetarian food is unavailable. Families facing the worst days of their lives are waiting hours or even days to secure a Hindu chaplain to provide proper end-of-life care. The institution itself is fracturing under the weight of this disconnect. Doctors and nurses are experiencing record emotional distress while treating a rising tide of chronic lifestyle disorders that medication alone cannot cure. Treating the biology without supporting the culture is an incomplete equation. The medical infrastructure urgently requires a bridge to time-tested holistic practices to stay afloat. In November 2025, the Hindu National Health Network launched in the House of Commons to build exactly that bridge. The strategy brings ancient preventative protocols, dincharya, yoga, and meditation directly into the official NHS 10-year plan. Supporting community health through these practices divert pressure from acute wards, reducing the hospital burden and cutting waiting times. These are resilient, mind-body solutions that have successfully maintained human balance across many generations. This approach has already gained top-tier institutional traction. The network presented its memorandum straight to the health secretary, alongside a coalition of key political dignitaries. The network functions as a system-level upgrade, wiring ancient cultural science into modern state infrastructure. Executing a change on this scale requires a very specific type of catalyst, the ambassador. This position is engineered specifically for individuals with heavy schedules. It maximizes high-level influence while removing any day-to-day administrative drag. The mandate is focused, advocating for the network, supporting strategic events, and unlocking funding for national growth. Add to that fostering community collaboration and offering expert insights to scale the organization's reach. The role applies your established networking and strategic capabilities to a specific national emergency. In return, the network offers a distinct return on service. This is a strategic partnership, built to enrich both the cause and the contributor. Ambassadors gain immediate access to an elite circle of national policymakers, healthcare leaders, and fellow high-impact influencers. Your public profile becomes permanently tied to deep ethical purpose, visible social responsibility, and tangible community healing. It elevates an accomplished executive into a recognized, benevolent leader on the national stage. The outcome of this partnership looks like this: a modernized healthcare system that celebrates cultural identity and balances acute medical treatment with deep spiritual well-being. That harmony brings concrete, measurable relief to isolated patients and drastically reduces the pressure on overworked nurses and doctors. It also guarantees that the vast, profound heritage of Hindu philosophy remains active, respected, and embedded in the UK for generations to come. True leadership is never defined by the heights you scale for yourself. It is defined entirely by the depth of your contribution to humanity. To finalize your transition from success to significance, reach out to the network at hindunhs.net.
Okay, let's dive right in. Today, we're going to break down a really fascinating document. It's a personal invitation from the Hindu National Health Network, and it's a direct appeal to some pretty influential people, asking them to help reshape healthcare right here in the UK. We're going to go through their argument piece by piece. Right from the very top, the invitation sets this incredibly powerful tone. You can see it's not just a simple request for a donation or something. It's framed as a call to leadership, legacy, and service. That headline tells you immediately, hey, this is about big ambitions, a deep sense of purpose, and making an impact that's going to last. So the first section really leans into this idea of leadership. The whole document is aimed at people who've, already made it. They've achieved a high level of success. And it kind of poses this question. Once you've gotten there, what's next? It's really an invitation to shift from personal success to creating a legacy for society. So, you might be wondering, who exactly is making this appeal? Well, this is the organization at the heart of it all, the Hindu National Health Network, or HNHN. And get this, it was launched in the House of Commons, and they call themselves a movement. Their main goal is pretty clear. They want to integrate the principles of Hindu philosophy with modern medicine, specifically within the UK's own National Health Service. Okay, so next, the invitation starts to outline the core problem that they're trying to solve. It points to some really significant gaps in our current healthcare system, which they argue is exactly why this kind of intervention is so urgently needed right now. The letter basically puts this question front and center. Why now? It frames its mission not as some kind of nice to have, but as a critical, necessary response to some very real, very pressing issues that are facing both patients and healthcare workers in the UK today. Now, this is where it gets really interesting, because the initial needs they point out are so specific. The HNHN highlights these fundamental cultural and spiritual gaps inside the NHS. The letter even shares stories of Hindu patients literally going hungry because food they could eat just wasn't available, or families who were struggling to find a Hindu chaplain during that critical end-of-life period. So we're talking about basic dignity and care here. But it's not just about those culturally specific issues. As you can see here, the letter then zooms out to talk about these huge systemic crises that affect everyone in the healthcare system. We're talking about staff burnout, the explosion of lifestyle-related diseases, and just this general feeling of a disconnect between our mental, physical, and spiritual health, all problems the NHS is grappling with on a massive scale. So, after laying out all the problems, the invitation then moves on to their proposed solution. And it's not about replacing modern medicine, but about making it better, enhancing it. The whole vision is about integration, fusing two really powerful but very different approaches to health and well-being. And this slide just illustrates their concept of bridging two worlds perfectly. On one side, you've got the modern NHS, scientifically advanced, focused on treatment. On the other side, you have Hindu philosophy, which they describe as offering these time-tested solutions that are all about prevention and integrating the mind, body, and spirit. The goal is to bring these two together to create a more whole, more holistic model of healthcare. Now, this is a really smart strategic point. The HNHN doesn't just present its vision in a bubble. The letter makes it very clear that their approach, promoting preventative care with things like yoga and meditation, actually directly supports the official NHS tenure plan. This is them saying, hey, we're on the same team. We want to be a partner in reaching these national goals. And that brings us to the specific ask of the letter. After explaining the why and the what, it gets down to the how. This whole section is about defining what this ambassador role is and what it would actually mean to take it on. So, what does an ambassador actually do? Well, the role is all about influence, not about day-to-day operations. As you can see here, it's about being a champion for the vision, helping with strategy, securing funds, and using your personal network to build powerful partnerships. The letter really emphasizes that this is a flexible yet meaningful role, designed to use someone's influence without it becoming a full-time job. And of course, it's a two-way street. The invitation is very clear about what ambassadors get in return. This isn't just a feel-good thing. It promises real, tangible benefits. We're talking about national recognition, access to an elite network of leaders and policymakers, and a seriously enhanced personal brand. But you'll notice it all comes back to that final point, the pure satisfaction of contributing to something larger than oneself. And that leads us to the absolute core emotional pitch of the entire invitation. This is the moment where the letter goes from a practical proposal to a philosophical one. It's an appeal to a much deeper sense of purpose, one that goes way beyond just wealth or career achievements. This quote is really the heart of the whole message. It draws this incredibly powerful line in the sand between two ways of looking at life. Success is measured by what we achieve. Significance is measured by what we give. That simple, memorable line frames the entire conversation, asking these already successful people to think about shifting their focus from what they can get to what they can give.
Building directly on that quote, the letter then frames the ambassador role as something so much bigger than just a title. It's presented as a real chance to help build a purpose-driven legacy. The idea is that this isn't just about small changes now, it's about creating an enduring impact on community health that will last for generations to come.
And so we end with this question, which I think really just captures the entire essence of what the HNHN is proposing. The whole invitation, with its mix of practical needs and this grand philosophical vision, it ultimately asks all of us to consider this. In a modern, scientific, state-funded healthcare system, what is the proper role for cultural and spiritual values? It's a huge question with no easy answer, but it's one this movement is determined to make us think about.